Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's dive in. Imagine hearing news that could just completely change how doctors tackle certain serious cancers.
Yeah, news offering, much better results, maybe even helping some people avoid really tough treatments.
Exactly, like major surgery or aggressive chemo. That's the kind of, seismic shift we're looking at today, focusing on some really incredible new findings in colorectal cancer.
And the potential impact here, it's really significant. We're talking about studies showing things like a 50% drop in the risk of cancer coming back or causing death for one group.
50%?
Right. And for another group, getting to a point where standard tests show no tumor at all, potentially skipping surgery entirely.
It's amazing. So this deep dive, it explores research that was just presented at the 2025 American Society of Clinical Oncology meeting. Now, colorectal cancer, we know it's a major health issue.
Absolutely. And screening is so vital for catching it early, but we've definitely needed bigger leaps in treatment for people who are diagnosed.
And the sources we're looking at today bring some fresh insights, really focusing on using the body's own immune system to fight these cancers.
Which is why, for you listening, understanding these developments is just so valuable. It's tangible hope.
Right. It really shows the power of tailoring treatment to the specific, the unique characteristics of an individual's tumor. Personalized medicine making a real difference.
Let's get into that first finding then. This one comes from a big study, multiple centers involved, looking at patients with stage 3 colon cancer.
Okay, stage 3. That means the cancer's grown into the colon wall and spread to nearby lymph nodes.
Exactly. So preventing it from coming back after surgery is absolutely crucial at that point. But there's a really important detail here about the type of tumor these patients had.
Specific genetic characteristic.
Yes. It's called deficient DNA mismatch repair. Bit of a mouthful, I know.
Okay. Deficient DNA mismatch repair. What does that mean in simple terms?
Well, think of your DNA as this huge instruction manual. Every time a cell divides, it gets copied. Normally, cells have amazing proofreading systems to fix typos, errors that happen during copying.
Like autocorrect, but for your genes.
Precisely, a really good biological autocorrect. But in cancer cells with this deficient DNA mismatch repair, well, those proofreading systems are broken.
So they can't fix the mistakes.
Right. And as the cancer cells divide super fast, more and more errors pile up in their DNA. It creates this sort of genetic chaos inside the tumor.
And our sources mention that about, 15% of people diagnosed with colon cancer have tumors with this deficient repair system?
Around that number, yes. And interestingly, these tumors historically haven't responded quite as well to standard chemotherapy alone compared to tumors where the repair system is working.
So how does that connect to the immune system and these new treatments?
Well, that's the fascinating part. Research noticed that because of all that genetic chaos, these tumors often look, foreign to the immune system. Yeah. They tend to have a lot more inflammatory cells, immune cells actually inside the tumor. And these immune cells have targets that immunotherapy drugs can latch onto.
So the faulty repair makes the tumor more visible to the immune system, potentially.
Exactly. That observation sparked the big idea. Could we boost the patient's own immune system to help it specifically recognize and attack these deficient DNA mismatch repair cancer cells?
Makes sense. So tell us about the study design. How did they test this?
Okay, so this was a big trial, 712 patients. All had undergone surgery for their stage 3 colon cancer, which had this deficient DNA mismatch repair characteristic. And remember, the cancer had reached their lymph nodes.
Right, so the goal after surgery is stopping it coming back. What's the usual approach?
Standard care for years has been chemotherapy after surgery. We call that the adjuvant setting, treatment after the main one.
Got it. So what did they do differently here?
In this trial, patients got the standard chemo for 6 months, but they also received an immunotherapy drug, atezolizumab, for those same 6 months.
Okay, chemo plus immunotherapy together initially.
Yes. And then they continued with just the atezolizumab for another 6 months.
And atezolizumab, that's one of those immune checkpoint inhibitors.
It is. These drugs basically release the brakes on the immune system, the natural brakes that sometimes stop it from attacking cancer. The idea is to unleash the immune system to hunt down and kill any remaining cancer cells.
And the results, what do they find?
The results were Well, really impactful. Adding the itolizumab immunotherapy to the chemo after surgery, it led to a 50% reduction in cancer recurrence and death compared to the group who only got chemo.
Wow, 50% lower risk. That is a huge difference for these patients.
It really is, and it makes you immediately think, okay, this should probably be the new standard for the specific group.
What did the lead researchers say?
Dr. Frank Sinekrope from Mayo Clinic, he was very direct, called it a major advance, and stated flat out that these findings will now change the treatment for this type of colon cancer.
Strong words. Did he suggest making it the official standard?
Yes, he recommended this combination, chemo plus immunotherapy, become the new standard of care for stage 3 deficient mismatch repair colon cancer. And they plan to propose this to the National Comprehensive Cancer Network. They write the guidelines most doctors follow.
That's significant.
And he made another important point about using immunotherapy earlier. Often it's been saved for more advanced cancers. Bringing it into this adjuvant setting for an earlier stage, even a specific subtype, is a big shift.
And this applies to people with Lynch syndrome too, right? That hereditary condition.
Yes. The study included patients with Lynch syndrome, which is often linked to these deficient mismatch repair tumors. It's the most common cause of inherited colorectal cancer, so it connects these findings directly to hereditary risk as well.
So bottom line for this first study,
Yeah.
if you or someone you know has stage 3 colon cancer with this specific deficient DNA mismatch repair feature, this chemo-immunotherapy combination offers a much better chance of survival and staying cancer-free after surgery.
It's definitely a major step forward for that group.
Okay, now let's shift gears a bit. There was another study also focusing on tumors with deficient DNA mismatch repair, but in a different context.
That's right. Still focus on that same genetic vulnerability, but this time looking at locally advanced rectal cancer. And they tried an even bolder approach here, using immunotherapy completely on its own.
Rectal cancer. That's often treated quite aggressively, isn't it? Chemo, radiation, then surgery.
Typically, yes. Because of where it is in the pelvis, that combination is common. And the surgery, well, it can be very complex, sometimes needing a permanent colostomy, which really impacts quality of life.
A huge impact. So this study asked, could immunotherapy alone work for some of these patients, maybe letting them skip all that other treatment?
That was the core question. It was a phase 2 study, smaller, designed to see if a treatment works and is safe. They enrolled 47 patients with locally advanced rectal cancer that had this deficient mismatch repair characteristic.
And the treatment was?
Quite straightforward, actually. 6 months of just one immunotherapy drug called dostarlimab.
Dostarlimab. Is that similar to the other one, atezolizumab?
Yes, it's also an immune checkpoint inhibitor, a PD-1 blocking antibody specifically. Same goal, unleashing the patient's immune system. But critically, in this trial, it was given before any chemo or radiation and potentially instead of surgery.
Given up front.
Okay.
And the results here, you said they were bold.
They were, well, frankly astonishing. Out of the 47 patients, 41 finished the full 6 months of treatment. And every single one of those 41 achieved a clinical complete response.
Oh, wait, every single one? All 41?
Every single one.
And clinical complete response means, like, standard tests couldn't find any tumor left, MRIs, scopes?
Exactly that. Using standard clinical tests, doctors found no evidence of disease. Gone.
That's incredible. What about the rest of the treatment? Do they still need chemo or surgery afterwards?
This is perhaps the most significant part. None of those 41 patients needed any more traditional therapy after the dostarlimab. No chemo, no radiation, and, crucially, no surgery.
No surgery for locally advanced rectal cancer. Avoiding that may be avoiding a colostomy. That's just monumental for patients.
It is absolutely life-changing, and they looked at how long these responses lasted.
Right. Were they durable?
So far, yes. 20 of those patients have stayed in complete response for at least a year after finishing therapy. The median follow-up time was almost 29 months from when they started treatment. It suggests these responses are holding up.
That's really promising follow-up time. What about side effects? Immunotherapy can have those.
It can, but in this study, they reported no serious adverse events, nothing worse than what's considered grade 2 or moderate. So it seemed to be well tolerated in this specific group.
Well, the researchers' conclusion must have been pretty strong.
Extremely. Led by Andreas Surchek, they basically stated that 6 months of this PD-1 blockade immunotherapy used alone gives durable, recurrence-free responses in this specific time of locally advanced rectal cancer, the deficient mismatch repair kind, and completely eliminates the need for chemo, radiation, or surgery.
This is, wow.
Yeah.
For this specific group of rectal cancer patients, then, it potentially means avoiding those really tough, life-altering standard treatments, but still getting excellent results.
It's hard to overstate the potential benefit here. Offering such a positive outcome with potentially much less treatment burden, it's a scenario we always hope for in cancer research.
Okay, let's pause for a second and connect these two studies. What's the big picture here?
Well, the common thread clearly is this deficient DNA mismatch repair. It seems to be a key that unlocks the door for immunotherapy in these colorectal cancers.
Right, it makes these tumors vulnerable.
Exactly. The colon cancer study shows that combining immunotherapy with chemo after surgery really boosts outcomes for stage 3 disease. It makes the standard adjuvant approach better.
And the rectal cancer study.
That one goes even further. It suggests that for some locally advanced cases with this dMMR feature, immunotherapy alone, given up front, might be enough to completely eradicate the tumor, potentially letting patients sidestep chemo, radiation, and surgery entirely.
It really drives home how crucial it's becoming to test tumors for these specific genetic markers, doesn't it? Like checking for deficient mismatch repair right at diagnosis.
Absolutely. We're moving further and further from a one-size-fits-all approach. Knowing the tumor's biology, like its mismatch repair status, is becoming key to picking the absolute best treatment strategy. These studies are perfect examples of that.
And it just highlights the power of using the patient's own immune system, either boosting it alongside other treatments, or maybe even as the only treatment needed for certain carefully selected groups.
Definitely. And as we mentioned, the link to Lynch syndrome also reinforces the importance for families with hereditary cancer risk.
Now, we should add a note of caution, right? Especially with the rectal cancer study.
Yes, definitely. While the results are incredibly exciting, it is a phase 2 study. That means a relatively small number of patients compared to the large phase 3 trials that usually confirm new standards of care.
And the long-term follow-up, while encouraging, is still ongoing.
Exactly. We need to see these responses hold up over many more years to be absolutely certain about the long-term durability. And crucially, these findings are specific to colorectal cancers with deficient DNA mismatch repair.
Right. This isn't for everyone with colorectal cancer. It's a specific subgroup, about 15% of colon cancers, maybe a bit less for rectal.
Correct. So it's a major advance, but for a defined population based on that genetic marker. Still incredibly important progress, though.
Absolutely. So wrapping up this deep dive, the main takeaway is pretty clear. Using immunotherapy for colorectal cancers with deficient DNA mismatch repair is a huge step forward.
Whether it's combined with chemo after surgery or maybe even used alone upfront in certain rectal cancers, it's offering options that are more effective and potentially much less burdensome for the right patients.
It really makes you think, doesn't it? How fast things are changing in cancer research. This whole shift towards personalized treatments using the immune system. What does this signal for the future? Maybe even beyond colorectal cancer.
Yeah. That's the big question. How will these immune-based targeted approaches reshape cancer care across the board? And building on that,
Yeah.
just how critical is it now for patients and doctors to really understand the specific genetic details of a tumor? Think about the power that knowledge gives, knowing if a tumor has deficient mismatch repair, for instance. It truly empowers everyone involved to find the very best path forward.
It's a lot to consider, but definitely offers significant hope, a really positive direction in tackling these diseases.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.